Madam President.
The senator from Arkansas.
Thank you, Madam President. Surprisingly, the President didn't talk much about Obamacare, his, quote, signature achievement. The people of Arkansas, the people of America certainly are talking a great deal about it, and they're writing a great deal about it also. And the reason being is that they're so concerned that health care has become an absolute mess. The President talked about a single mom that was able to resolve the problem of her pre-existing conditions. And I think that we all agree that that's something that was desperately needed. I'm an optometrist, an eye doctor, and very much aware of the situations that people have been put in the past. The reality is, though, that we can fix this problem, problems like this, without creating a massive bureaucracy, without creating a situation where we have thousands of pages of regulation. And the reality is the unintended consequences of the situation that we're in now with Obamacare is we've made it unaffordable. We've made it such that millions of Americans simply can't afford the health insurance that they're being offered. Let me talk about a few that where people have written me and talked to me about. This is Jack from Springdale. I just found out recently from my health insurance provider that my current health insurance policy will be discontinued effective the 1st of next year, and a replacement policy will be approximately double, which will be around $1,200 per month. My question is this: what is Obamacare supposed to do about that, and if not, what can be done to fix it? Here's Leonard and Joanne. This letter comes to you to ask for your needed support to defund the Affordable Care Act in any way possible. We recently received notification from Health Advantage of Arkansas that our 2014 monthly premiums increased to $173.70 for a total of $1,360. Our out-of-pocket max increased from $3,000 to $5,000. The primary care physician copay increased from $25 to $35, and the specialist copay increased from $35 to $70. If either of us has to visit the ER, that copay increased from $100 to $250. The drug copay also increased. We are insulted to have to pay for benefits such as maternity, pediatric dental, drug rehab, which we have no need for since we are in our 60s and do not use drugs or alcohol. Health Advantage of Arkansas explained that these changes to our policy and increased cost were due to compliance to the Affordable Care Act. We have supported you in the past and would like to know what your plan is to relieve Arkansans and other Americans from these additional finance burdens imposed upon us by the Affordable Care Act. Mary in Little Rock writes that she received a notice that her MedPAC Advantage plan was canceled at the end of last year. She explains, "I had no idea that Obamacare was going to also affect Medicare. Now, to receive comparable coverage for 2014, I will have to pay an additional $500 plus in premiums. This additional cost will definitely place an unfair burden on my finances. What are you and the Senate going to do to correct this situation?" I think Mary asked a very fair question. What are we going to do to correct her situation, the situation of so many others? And I think the answer is that we need to repeal Obamacare. We need to put in place a system that does take care of the problems that we have, but without the bureaucracy, without the tremendous expense, and make health care affordable for all Americans. I yield back.
Madam President, or Mr. President. Sorry.
Senator from South Carolina.
Mr. President, I appreciate the comments of my colleague from Arkansas and prior to him, those from Missouri and Wyoming, and we'll be hearing in a minute from a colleague here from Nebraska, all of whom are expressing the sentiments that are conveyed to them by their constituents in their individual states about the very real and very personal impacts that Obamacare is having on them. Last night in the President's State of the Union speech, he sort of glanced over that issue. It's kind of the equivalent of a drive-by, sort of acknowledged the law, said it's not going to change, and if Republicans have better ideas, then come forward with them. Well, you just heard the senator from Missouri, Senator Blunt, list off 10 or 12 things that we think could be done that would be dramatically different and dramatically a dramatic improvement and a very different approach from what is included in Obamacare, which is a heavy-handed government-driven solution to health care, which essentially puts the health care in this country, which is 1/6 of our economy, under the political control here in Washington, D.C. And as a consequence of that, what we're seeing out there is higher premiums, higher out-of-pocket costs in the form of deductibles and copays, canceled coverages, and fewer choices when it comes to doctors and hospitals. That's been the real-world impact of the passage of Obamacare. And the President said when he was running for office that he was going to reduce health care costs by $2,500 per family. We now know that they've gone up since he's taken office by about $2,500 per family. And they continue to go up all the time. We hear consistently from our constituents in our individual states, and those stories that are being shared this morning, I think, are just good examples, again, of the real-world impacts of this law and why it is so important that we go back, start over, do this the right way, with reforms that actually address the issue of creating more competition, more choice for individuals, allow market forces in the world of health care as opposed to having this overreaching government approach, which clearly hasn't worked. And the one thing that many of us got up and talked about when Obamacare was being debated is the fact that there really wasn't anything in there that constrained utilization or that put downward pressure on costs. And so costs keep going up, that keeps getting passed on, taxes keep going up, they keep getting passed on. And what does that mean? Well, for middle-class families, it means higher premiums and higher deductibles, higher copays, and in many cases fewer jobs, because that's the impact it's having on the economy. And it really worsens the very thing the President says he's most concerned about, and that's the issue of income inequality. Because when you are driving up the cost for consumers in this country in their daily lives, and I would say health care for most people is a very significant cost, and I would add energy to that, but those are a couple of things where we have seen policies that have made it more expensive for middle-class Americans to make ends meet. And health care is certainly an example of that. And I'd like to share just a couple of examples from my state, and of course, as has been mentioned earlier by my colleagues, we hear these from the form of email, letters, phone calls coming into our offices, lest anybody think that what we do here is done in a vacuum. These are not abstract issues. These are very real, personal experiences that people across this country are having. This is from a constituent in Harrisburg, South Dakota, which is a growing community near Sioux Falls, South Dakota, a growing, vibrant community. It says, my wife and I have been fortunate to have become small business owners and entrepreneurs. So far, we've been successful of living the American dream for the last 3 years and have seen great success at what we do. Unfortunately, with Obamacare, we're needing to make choices I never thought we'd have to make. Based on the rates for health insurance, we would be paying approximately $800 out of pocket per month. Essentially, we're thrown in to make an additional house payment per month or face a penalty at the end of the year and not have health insurance. Constituent goes on to say, needless to say, I'm very disappointed and upset right now. I feel I'm being taken advantage of because I'm a small business owner and wanted to live the American dream. This is another constituent from Rapid City who says, and this was in the form of a letter regarding the President's broken promises. He says, bottom line is the President lied to us. He said if we like our policy, we can keep it. He said we would be saving around $2,500 a year. Wrong on both accounts. He then concludes, when our policy expires, it will be canceled and we'll have to pay almost triple what we're paying now. Those are examples from my state of South Dakota. My colleague from Arkansas shared some examples from him. I know my colleague, my neighbor from Nebraska, Senator Johans, hears many of those same stories coming from his state. He represents people very much like those I represent in South Dakota who in many cases make their livings the same way, but are just experiencing the economic consequence of a bad policy, a failed policy, a bad law that was rushed through here, and they're now, American people, unfortunately, are experiencing the impacts, the adverse impacts of that on their own personal economic lives and, in a broader sense, on our economy nationally. Higher costs, canceled coverages, fewer choices in the form of doctors and hospitals, and fewer jobs for American workers that we want to get back to work. That's the real-world experience. There's a better way. Senator from Missouri talked about many of those ideas. I hope the President would work with us to repeal this bad law and start over in a way that makes sense for the American people and for our health care economy in this country. Mr. President, I yield the floor.
President, the Senator from Nebraska.
Thank you, Mr. President. I want to express my appreciation to Senator Boozman, Senator Thune for being down here this morning to talk about an issue that's extremely important and an issue that we certainly are hearing a lot about in our Senate offices and hearing a lot about when we travel back to our home states, and that's the whole issue of Obamacare. The President, of course, mentioned this in his State of the Union last night, and I think he really hopes that he can change the subject here. But the reality is you can't, because so many people are being hurt by this legislation. Over 4 years ago, when the health care law was being debated, there was one concern that dominated the discussion when we talked to our constituents back home. That concern was cost. They talked about the rising cost of health care and wanted to see what we thought in terms of this law's impact on that. But since this year's rates were posted, Mr. President, it has become absolutely obvious that this law did not hold true to its promise to reduce costs. Our Nebraska insurance director was asked to comment about this when the rates were coming out, and he said, quote, "Basically the rates are going up," unquote. No truer words could have been spoken. A CNBC headline read, quote, "Consumers say they're shelling out more for health insurance," unquote. But it's not just those headlines or the opinion of our director of insurance. It's what's happening to real people in their lives. A father from just outside Omaha, Nebraska, wrote a letter to me, and he said this: in 2013, his family's flexible spending account was cut from $5,000 a year to $2,500 a year as a result of the health care law. If there was one thing that people appreciated, it was the flexible spending account. Why you would want to cut this doesn't make any sense, but that's what the health care law did to him. He goes on to say that his wife's employer-sponsored insurance premiums have increased by an incredible 50%, and their deductible and maximum out-of-pocket costs, well, they haven't gone down, they've gone up too, and these increases have been the worst they've seen in 14 years of employment, all due to the health care law. His sons, who are struggling to pay for college, had their work hours restricted to 28 hours a week. Why? Because of the law. So as a result, they're applying for more financial aid, they're going further in debt, and even taking on part-time jobs so they can stay in school. But that's not the only person that has written to me. A Nebraskan from south central part of the state reports this. He spent 27 hours trying to enroll on healthcare.gov, only to find out he couldn't afford coverage, even with a premium subsidy. Under the best option, his deductible would increase by $7,000. Now, Mr. President, to a middle-class family, $7,000 out of pocket, it's bankruptcy. They don't have it. It's not like that money is going to fall out of the sky. A young traveling nurse from northeastern Nebraska also faced sticker shock, reached out to me. Under a new plan, her premium more than doubled, and her deductible went from $3,500 to $6,500. And she wrote to me and she said, quote, "This is not affordable when I have student loans to pay for and I'm trying to support myself," unquote. Now, it's possible that some Nebraskans have temporarily renewed their old policy under the delay that was announced by the President, but that just means that they have delayed the pain until next year, and we'll see more of these stories of skyrocketing costs and deductibles Well, let's face it, Americans didn't get what they were promised when the law was passed. They expected a bill that would deliver on the promises and address the cost of health care. Instead, they're stuck with the very real consequences of a poorly crafted policy. And I think it's time that we show Americans we can do better. I believe the place to start is to repeal the law and start working on step-by-step solutions that draw down health care costs for American families. Those of us on the floor today are ready to tackle the challenge, and I hope we find willing partners. Mr. President, thank you. I yield the floor. I note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander. General speeches for the next few minutes here in the Senate. The legislative focus today is expected to be the flood insurance bill. Senators seeking to make changes to the 2012 flood insurance law, including delaying rate increases for 4 years. Debate on amendments and a vote on final passage later today.
Consent to call off the quorum call.
Without objection, the quorum call be suspended. Under the previous order, the leadership time is reserved. Morning business is now closed. Under the previous order, the Senate will resume consideration of the motion to proceed to S-1926, which the clerk will report.
Motion to proceed to S-1926, a bill to delay the implementation of certain provisions of the Biggert Waters Flood Insurance Reform Act of 2012 and so forth, and for other purposes.
The previous order, all post-cloture time is yielded back and the motion to proceed is agreed to. The clerk will report the bill.
Calendar number 294, S-1926, a bill to delay the implementation of certain provisions of the Biggert Waters Flood Insurance Reform Act of 2012 and so forth, and for other purposes.
Under the previous order, amendment numbers 2702, 2704, 2705, and 2698 are considered proposed and agreed to.
Mr. President.
Senator from New York.
I ask unanimous consent to call up my amendment number 2708 and ask for its consideration.
Is there objection? Without objection, so agreed. The clerk will report the amendment.
The Senator from New York, Mrs. Gillibrand, proposes an amendment number 2708. At the end of Title I, add the following.
I ask consent to vitiate the remainder of the reading.
Without objection, so ordered.
I first want to thank Senator Menendez, Senator Landrieu, and Senator Isaacson for their tremendous leadership on the Homeowners Flood Insurance and Affordability Act, which I am a very proud co-sponsor of, and for working with me and my staff on an amendment that is so critical to so many New Yorkers who are still recovering from Superstorm Sandy. My amendment is quite simple and common sense. It's aimed to help homeowners who are currently stuck in a bureaucratic ditch that is impossible for them to climb out of due to the immovable reality of the building that they live in. Under today's FEMA policy, flood insurance premium rates are based on the elevation of the house relative to the base flood elevation, which is the elevation that FEMA calculates that flood waters have a 1% chance of rising to in any given year. Under normal circumstances, homes can be elevated to avoid high insurance rates that are assessed on homes that are built below the base flood elevation in special flood hazard areas. But in places like New York and New Jersey, this is impossible for owners of older urban homes such as brownstones, row houses, and multifamily buildings, which can predate back to the pre-Civil War, that in many instances cannot be raised due to structural characteristics and were built before flood maps were in place. When their homes are mapped in a flood zone, they are simply left without any options to lower their flood insurance premiums, which can be as high as tens of thousands of dollars each year. So to fix this, my amendment would require FEMA to provide a uniform set of guidance that provides FEMA-approved methods of mitigation for homeowners who just simply can't elevate their homes. This amendment would require FEMA to look at whether a homeowner has implemented any of the prescribed alternatives and take that into consideration when calculating a home's flood insurance risk premium. By providing a clear set of mitigation alternatives for these homeowners, this amendment will help New Yorkers and homeowners across the country who cannot elevate their homes to reduce their flood risk. It will help homeowners prevent costly damage to their homes during the next storm or flood and save money in potential disaster recovery costs in the long term. I suggest an absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
Mr. President.
The senator from Louisiana.
Thank you, Mr. President. Mr. President, I ask unanimous consent to call off the quorum call.
Without objection, the quorum call be suspended.
Thank you, Mr. President. Mr. President, I rise in strong support of the flood insurance fix bill on the floor today, and I urge my colleagues on a bipartisan basis to come together and to pass this first crucial step toward getting it right with the National Flood Insurance Program. It's important for America, It's important for millions upon millions of Americans, homeowners, not just in Louisiana, not just in Florida, but in every state. Every state of the country is absolutely affected. And I also specifically urge my colleagues to defeat the Toomey Amendment, which I think is very well intended but will not get the job done, and to waive the budget point of order, which is a largely technical point of order. And I'll explain each of those in turn. First of all, Mr. President, the need for this bill to get things right. All of us came together over a year ago and passed the so-called Biggert-Waters Act to reauthorize the National Flood Insurance Program and to reform it in important ways. And we needed to do that broad brush. The program needed to be continued, not just in short-term fits and starts, which had been the pattern for many years. In fact, in 2010, it was so bad we actually let the program lapse 4 different times by inaction, shutting down thousands upon thousands of real estate closings that we needed to build up our economy, shutting this down every time. So we needed that reauthorization. And we needed and still need reform of the program. We need to build up the program to make it fiscally sustainable, to make sure that over time we get revenues, premiums coming in that cover the full costs of the program. And there's no debate about that, and that's why we passed that bill. What was not foreseen, Mr. President, was that in some significant number of cases, those reforms, once they were put into effect, would actually lead to completely unaffordable rate increases, a completely unsustainable path forward that wouldn't even get us toward the goal of building up the fund and building up the program to make it fiscally sustainable. No expert predicted that beforehand. No one from FEMA said you will have some rates that are completely unaffordable. No outside insurance experts said that. But once the details of the reauthorization were begun to be put in place, that became very apparent. Now, Mr. President, we don't know exactly how many cases we would have like this, but we know they're not just isolated cases. We know they're not just in coastal communities. They're in every state to some extent or another around the country. And over time, members of both parties from every state have begun to understand that, which brings us together, hopefully, in a constructive way on the floor today. Certainly, that situation is dire and the threat is very real in Louisiana. Months ago, for instance, I visited a neighborhood in St. Charles Parish, part of southeast Louisiana, right on the Mississippi River. I visited a very nice, solid, middle-class neighborhood. I met with many, many homeowners there, and they presented me with a box this big at least, full of keys, house keys. And they were these folks' actual house keys, and they were saying, if this isn't fixed, if this isn't done right in time, we're going to have to turn these keys in to the bank, to the government, to whomever, because we would face not just premium increases. We had all accepted premium increases as part of the reforms, as part of the reauthorization, but completely unaffordable, unsustainable increases, literally going to $12,000 or $18,000 or $27,000 a year, not on a millionaire's home, on a modest middle-class home. That just doesn't work. And these folks were saying very sincerely, very directly, here are my home keys, because that's where this is headed. Now, that's not right on so many different levels. First and foremost, it's not right for those Americans who have lived by the rules every step of the way, who built to the right elevation when they built their home, who got the flood insurance required by law and required by prudence, who paid all of their premiums, who went through mitigation programs, if they could, to raise their homes in many cases. But these are folks that are not living right on the coast, that are not choosing highly dangerous areas, who do not have second homes, beach homes. We're not talking about that at all. We're talking about a solid middle-class neighborhood way off the Gulf Coast, way off the Gulf Coast. People who followed the rules every step of the way, who still faced the prospect of those completely unaffordable increases. That's not right and it's not fair. On a second level, that reality threatens whole communities and threatens our economy. Because if that were allowed to happen in any significant number of cases, it would be an economic spiral downwards. Banks would be burdened with foreclosures. Local businesses would be hurt significantly. Whole communities would be in an economic spiral downward. And again, we're not just talking about second homes on a beach. We're not talking about that at all in Louisiana. And by the way, this bill does not give any relief regarding second homes, for instance. We're talking about a lot of communities and a real and unsustainable hit to our economy. And on a third and final level, that reality would ensure we don't even get to the goal of these reforms, which is to make the system whole and fiscally sustainable. Because to do that, we need more folks in the National Flood Insurance Program, not folks leaving, turning in their keys. That will kill any effort to make the program solid fiscally and sustainable fiscally. So on every level, we cannot allow this to happen. The Menendez-Isaacson bill, with the help of many other members, including myself, was put together to get us to the right place. And it takes the important first step to make sure we get it right. FEMA does the mapping right, which they're not doing right in some cases now. FEMA does the affordability study mandated in the original Biggert Waters bill, but which FEMA has not even begun yet. We do all those things to get this right and avoid completely unaffordable rate increases. And I urge my colleagues on a bipartisan basis to support this good bill. We also need your support in defeating the Toomey Amendment and waiving the budget point of order. And let me speak about those briefly. Pat Toomey's amendment is very well intended, but it falls short, in my opinion. It limits any delay in rate increases to 2 years, and some rate increases continue for those 2 years. And most importantly, it doesn't mandate and ensure that FEMA ever gets through this affordability study, ever makes recommendations to Congress for the ultimate fix, doesn't give us any time to react and legislate in that area, and it doesn't ensure in any way that FEMA gets its mapping right based on true sound science and engineering methodologies. So that's just kicking the can down the road and not ensuring in any meaningful way that we're going to get it right. That simply isn't good enough. We need to tie in any delay to figuring out the ultimate fix by having FEMA complete its affordability study, by making FEMA make recommendations to us, by giving us 6 months to act on those recommendations, by mandating that FEMA do its mapping correctly and not have rate increases before it rushes forward with incorrect mapping, which is going on right now in some cases. That's what the underlying bill does. That's what the Toomey Amendment does not do, as well intended as it is. Secondly, there will be a budget point of order vote, and we do need 60 votes to waive that budget point of order. And I will vote yes to waive it as a strong fiscal conservative, because this is necessary to get this national flood insurance system right and to make it fiscally sustainable. In fact, over the 10-year budget window that we normally use in scoring, this bill has no score over those 10 years. It just has some scores in some intermediate periods of time, which gives rise to the budget point of order. So I urge my colleagues to vote to waive that point of order, knowing that there is no score over 10 years. Also knowing that, quite frankly, the fiscal assumptions about the current law are enormously flawed. The notion that we're going to make the National Flood Insurance Program more stable and more fiscally sustainable by having a bunch of premiums go up to $27,000 a year on a modest middle-class home is crazy. That's not going to get us to a better place. That's going to get us to a worse place. That's going to shrink the program. That's going to have people leaving the program paying no premiums, not paying higher premiums. Yes, reasonable premium increases have to be part of the solution, but completely unaffordable premium increases aren't part of the solution because people can't afford to pay them. So they'll pay zero instead of something substantial. They'll leave the program instead of putting more homeowners and properties in the program, which is essential to get to a strong and stable fiscal situation. So again, on a bipartisan basis, I urge my colleagues to support this bill. It's a very important step to stabilize and fix the situation and to defeat the Toomey Amendment and waive the budget point of order, which is absolutely necessary in this process to support a good bill. Thank you, Mr. President, and I yield the floor.
Mr. President.
Senator from New Jersey.
I just want to take a moment to thank the senator from Louisiana for his input into the legislation, his work, his advocacy, and I agree with him on the underlying statements that he made, particularly as it relates to the necessity for the legislation as well as the opposition to the Toomey Amendment, which I understand what Senator Toomey is trying to do, but I agree it doesn't meet the ultimate challenge, as well as the budget point of order for the reasons that Senator Vitter said. So I just wanted to take an opportunity to say thank you for your support. And yield the floor and observe the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
Senator from New Jersey.
I ask unanimous consent that the quorum call be issued.
Without objection, the quorum call be suspended.
Mr. President, I ask unanimous consent that the time that takes place during the subsequent any subsequent quorum call or the subsequent quorum call that I'm going to ask for can be equally divided on the Gillibrand amendment.
Without objection, so ordered.
Mr. President, I observe the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
The Assistant Majority Leader.
Consent the quorum call be suspended.
Without objection, the quorum call be suspended.
And, Mr. President, I have 8 unanimous consent requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders. I ask unanimous consent these requests be agreed to and printed in the record.
Without objection, so ordered.
Mr. President, I rise today to pay tribute to Hydea Pendleton, lost to gunfire 1 year ago today, January 29th, 2013. She was 15 years old. She was gunned down while she was standing with friends in a park on Chicago's South Side. A talented, caring girl with a bright future. She was a sophomore at King College Prep. She was an honor student, majorette in the school band. This is her photograph. Those who knew her talk about her warm heart, her big smile. What a great friend she was to all those around her. A week before her death, Hydea was here in Washington, performing with her school band in Washington, D.C. for President Barack Obama's inauguration celebration. She was absolutely thrilled that as a high school student she could come out and perform for the president she loved. Days afterwards, she was gunned down, murdered by men who allegedly mistook Hydea and her friends for members of a rival street gang. I join with those in Chicago and across America who mourn this grim anniversary, and I extend my condolences to her family. This last week or two, even longer now, has been pretty cold in Chicago, bitter cold. Snow, ice, people don't go outside much. But I wanted to make a trip Saturday morning to visit Hydea's mom and dad on the occasion of this sad anniversary. Her mom, Cleo, her father, Nate, and her 11-year-old brother, Nate Jr., as well as the extended family, are mourning her loss. We sat in their apartment Saturday morning, just talked a little bit about her, talked about what it meant, what the reaction had been. The parents were heartened that King College Prep had not forgotten their daughter, that today they were having a special observance and ceremony to remember her. It meant a lot to her mom and dad. They've been out here to testify before my Judiciary Subcommittee about issues involving gun violence. They've been on television. They've made the rounds, but when you're there with them in the apartment, you know that after the cameras are gone and all the visitors are gone, it's still a sad remembrance of a beautiful young girl whose life was cut short. No family should have to experience what they went through. But like so many families who've lost loved ones to sudden violence, the Pendletons have decided to dedicate themselves to turning their pain into a purpose. They're working to reduce the scourge of gang and gun violence so that other families can be spared. They've established the Hydea Pendleton Foundation in Chicago to create a safe space for city youth and provide after-school enrichment programs to help kids avoid the violence on the streets. Idea, incidentally, was once featured in a public service announcement video where she said, "It's your job as students to say no to gangs and yes to a great future." The foundation named after her will help other students reach that goal. I commend the family for their work on this foundation. I believe it will make a difference. Idea's family, as I mentioned, has traveled out here to Washington to talk about our laws and how to change them to avoid future violence. In particular, they've spoken out about the need to crack down on the gun supply to gang members. The current federal laws on what we call straw purchasing and gun trafficking are an embarrassment. They're too weak. They need to be strengthened. I've joined with my colleague, Senator Mark Kirk, my Republican colleague, in a bipartisan effort, and a number of our colleagues have joined us to introduce tough legislation to crack down on straw purchasing and trafficking. We call this bill the Stop Illegal Trafficking in Firearms Act. Mark Kirk likes to call it the Hydea-Pendleton Act. We agreed to name that key section after her since we believe this legislation just might reduce the senseless gang shootings like the one that took her life. Straw purchasing, for any who don't understand it, is when the girlfriend of a thug who has no criminal record goes to buy the gun to hand to him to commit a crime. He can't buy it. Couldn't walk in the store and buy it. He can never pass the background check. She does. And when she passes it, she hands him a gun, and unfortunately violence and death can be the result. Last April, our anti-trafficking legislation got 58 votes on the floor of the Senate. 58 votes to stop the trafficking of guns into the hands of criminals. That's a few votes short of what we needed. We're close. Our job is to convince just 2 or 3 more senators to join us. The Pendleton family understands that even though this law seems so obvious, so reasonable, and can save lives of innocent people, it's going to be hard to come by. There's a gun lobby here in this town. They're very powerful, and their allies will do everything they can to fight even the most popular common sense reform, like cracking down on illegal gun trafficking. The gun lobby says we shouldn't pass any new gun laws and that we should just enforce the laws already on the books. Actually, the gun lobby is in court every day trying to strike down the laws already on the books. The bottom line is that the gun lobby always seems to oppose laws that might reduce gun sales. They just want volume of firearms sold. If they had their way, no questions asked. But it's time to crack down on the sale of guns that end up in the hands of criminals and gang members. We need to push forward in Congress and state houses and in the law enforcement community with strong efforts to cut off the supply of straw-purchased, illegally trafficked guns. The path may not be easy, but it's the right path. And if we succeed, we'll prevent crimes and save lives. I want to commend the Pendleton family for the courage they've shown in the face of their tragic loss. I commend them for their efforts to try to spare other families. I hope lawmakers will just reflect for one brief moment about this good family who lost this great daughter and now has dedicated a big part of their lives to preventing shootings in the future. We owe Hydea and her mom and dad and her memory our best effort to make this a safer America. Mr. President, I yield the floor. Suggest the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
President.
The senator from Nevada.
Thank you, Mr. President. I ask that the quorum call be dispensed with.
Without objection, the quorum call be suspended.
I ask that the pending amendment be set aside, and I call up amendment number 2700.
Without objection, clerk will report the amendment.
Senator from Nevada, Mr. Heller, proposes an amendment number 2700.
Mr. President.
Senator from Nevada.
I ask unanimous consent that the reading of the amendment be dispensed with.
Without objection, so ordered.
Good, Mr. President. Thank you. I'm here today to talk about the Heller-Lee amendment to the flood insurance legislation that we're currently considering. One of my core beliefs in order for Americans to succeed is that regardless of the issue, we need more choices, we need higher competition, and we also need less cost. So let's talk about the NFIP. Right now, the National Federal Insurance Program has a near monopoly on the flood insurance market. In fact, I think if you ask most Americans if they knew that there were other flood insurance policies other than through NFIP, you'd probably get a blank stare. What most people don't know is that since the passage of the National Flood Insurance Act of 1968, private flood insurance has been understood to satisfy requirements and mandates to purchase flood insurance. In fact, when Congress passed the last flood insurance reform package under Biggert-Waters, Congress reaffirmed the intent that private primary flood insurance should satisfy requirements and those of mandatory purchase. Unfortunately, due to the lack in legislative language, there have been pervasive rejections of private primary flood insurance by most lenders. This is due to the fact that lenders are unsure about the validity of private issued flood insurance, despite the fact that this insurance has been issued and accepted in the past. For this reason, I, along with Senator Lee, have worked on an amendment that would provide clarification and hopefully eliminate this uncertainty. The Heller-Lee Amendment provides a simple and clear definition of what is acceptable private flood insurance. Our amendment would define acceptable private flood insurance as a policy that provides flood insurance coverage issued by an insurance company that is licensed, admitted, or otherwise approved to engage in the business of insurance in the state or jurisdiction in which the insured building is located. Private insurers are already subject to statutes and regulations in each and every state. State insurance commissioners are the best regulators to allow and disallow any policy they deem proper or improper, and they have significant ability to assure fair and equitable settlements of claims. Further encouragement of private sector participation in the flood insurance market will help reduce the risk to which U.S. taxpayers are currently exposed. In fact, Mr. President, I'd like to share some statements that I just received from FEMA after I asked FEMA if private flood insurance is a viable tool for some consumers to find lower cost options. And FEMA stated, and I quote, "Private flood insurance would create competition. It is possible some homeowners could find lower cost options for flood insurance as a result of privatized market competition," unquote. So I ask my colleagues to support the Heller-Lee Amendment so that we can give the American public more choices, higher competition, and less cost when it comes to flood insurance. Mr. President, thank you. I yield the floor and suggest the absence of a quorum.
The clerk will call the roll.
Thank you.
Mr. Alexander.